Can you hear me, Ms. Upka?
How many people do you have in person so far for this
Okay, thank
class?
you. You again might want to call the school and just let them know, just because we're trying to figure things out. And so it's just going to be helpful. All right, cool. Now I know a few more information than I did before I started. Okay. So look at my screen. I'm just going to show you some things here. Oh, okay, so are people talking to me? Because I can't hear them. All right, I'm going to go out and come back in, and then maybe I will be able, oh, you know what? Let me see. Let me make sure I'm not on mute, because that might, no, I'm not on mute. All right, I'm going to go back out and come back in. Miss Gray, you just kind of handle things until I get back. It'll be 2 seconds. Okay, Miss Gray, can you unmic and talk to me? Am I able to hear you guys?
I can hear you now. Well, I could hear you before. Yeah,
okay.
Can you hear me now?
Yes, I can. Thank you.
Okay.
By the way, there's two of you, Miss Zepka.
I know. I have 2 screens I have here so I can like present, but also still see what's going on in the class. So thank you. I do know that though. Okay, so I just wanted to show you this part of the screen. So just kind of bear with me here for a minute. We will be starting our warm-up. So most people, they go and they open a new Google Doc and they title it January 18th through the 29th. So for some of you that are ready to go for that, but I just wanted to show you on Google Classroom. So if you look at my classroom right now, if I go to my classes, I have a lot of gibberish going on, okay? So what you can do is you can move these around, which I didn't know if you knew that or not, but you can move them. And you can move our old parenting and family class, the old one, down to the bottom so that it's not at the top. Or you can also archive your classes too. So I'm trying to remember where that would be. There's a way to archive your old classes. I want to think it's right here. So archive just means that they're going to keep everything, but they're going to hide it from view. So you could do that too if you needed to. So once everybody's good on that old classroom, I'm going to archive it. I'm just going to get it off my main screen so that I'm just focused on the one that we're working with, okay? So if you look at it, a couple things that I scored this weekend were this is the old this is the new warm-up, but the old warm-ups I graded. You can still, you can still function with that other class if there's still things that you have to get done or need to turn in, it'll still tell me. But our birth defect presentations are here, and our guided notes are here also. So you guys can just turn in your guided notes here.
I have a question.
Yeah.
Why does that both one? Is that birth defect up at the second one after the first one? Is that like an example?
Well, you just need to worry about the one that's on your page. I am the teacher, so I have different things that I have that you don't. Okay.
Because I have that. It says that birth.
Yep. Yep.
One.
Yep. So this is just, I'm trying to show you what I'm seeing, but it's not going to be the exact same as what you have. Okay. All right. So that just kind of gives you an idea. And then I want to start with our new set of warm-ups. So why don't you go ahead and open a Google Doc, and we're going to go ahead and start in on our new warm-ups for this 2 weeks. Okay. Now next week it'll be a little bit different because we'll see each other 3 days instead of 2. So those that are in person will actually have the class time to complete. But if you're virtual, that still means that, you know, I'll show you on Wednesday and Friday, but you'll have an extra one to do that you'll have to do on your own. Okay. All right. So without further ado, I'm going to go ahead and show you the warm-up question, and then we'll get started with that. Whoops, it's right here. All right, so here we go in 3, 2, 1, start. You only need to answer the PF question, which is parenting family. And the question is, what have you learned about birth defects in the last few days, okay, that we were together? So just anything that comes to mind, make sure it's in a complete sentence. And then I've already started the 2 minutes, so get started on that. "40 seconds. Try to finish up."
It'll finally be nice to see each other in person.
Yeah. Okay, so time is up. Remember that this will be the last week of the recordings. So if you fall behind or need to watch class notes or something like that, you can always access them in the live stream. So what we've been doing the last couple times that we've come together is we have done these guided notes. And so we are almost through with them. So we'll be turning those in. I did put the deadline as this Friday because I'd like to do a little bit each and every day and then finish them up. Okay, so hopefully we can do that. I do also want to start with a little reviewing of what we've talked about thus far, and then we'll get back into our notes. Okay, but when you turn your notes in, you will need to turn them in the new 2021 family parenting class. Okay, right here. All right, so let's just, yes.
I just wanted to let you know on the warm-ups, right there in the classwork, you've got the dates there, the 18th through the 29th.
Yeah.
But when you open it, it still says the 11th and 12th for today's class.
I thought last week we were on something else.
Okay, so when I put the warm-ups on the main screen, it's for the 2 weeks. And then the ones that I put in the slideshow are the day-by-day ones. Does that make sense?
Yeah.
Oh, I know what you're saying. I know what you're saying.
Okay.
Why are we
going to print it? And I was like, oh,
Okay, McKenna, can you try using the chat, please? All right, so yes, I think I was wishing that it was a different date, maybe. I don't know, that's weird.
That's what I figured.
Okay, thank you. That is a good correction. Well needed. Okay. All right, I think I got my act together now. Let's hope. Only time will tell, right? All right, so let's do a little Quizlet. see how we're doing there. All right, so if you know the answer, just unmic yourself so I can see, and then we'll go through this. And a lot of these questions you'll see on your assessment, so hopefully you've been studying them. So what do you call too many or too few chromosomes? What is that called? Anyone have an idea? And you can use the chat because I can see that if you choose to. It's up to you, but anybody? Okay, so that's called the chromosomal error. Oh, I don't know how that happened, but okay. The study of the way animals and plants pass on to offspring. What's that?
Environmental causes.
Genetics. Okay, characteristics obtained directly from the genes of both parents. What do you think about this one? And you can put in the chat or you can unmic. It's always nice to have some participation. What do you think it would be? Heredity. What is the basic unit of life? You've learned this since elementary, middle school. Starts with a C. Thank you.
Isn't it like a cell? Yeah.
Cell, yes. Yep. You guys got it. Yep. Okay. The portion of the cell outside the nucleus. What would that be? This is taking us right back to those notes where we had that picture of a cell and then all of the aspects of the cell. Cytoplasm. And then the center of the cell, what would that be? The very center. You guys know this one.
Nucleus.
Thank you. Okay, a thread-like structure made of DNA molecules that contain the genes that are 46, 23 from each parent.
Chromosomes.
Yes, good job, McKenna. All right, bands on the chromosomes. What are the bands called?
Genes.
Thank you, Azaria. Oh, whoops. So your genes, another word for those are DNA. Okay, the division of the nucleus, what is that called? Do you remember? Starts with an M.
Mitosis.
Yes, thank you. I'm not going to be able to see the hands up. I missed that, so I'm glad that you.
Miss Zepka,
Yes,
is some of the kids going in person?
yes, sir.
Okay. So
Yeah.
I don't know if I don't have a way to get to, because I'm all the way in Lakeview, Brown Lakeview.
Uh-huh.
I have to transfer back to Lakeview.
Oh, really?
Yes.
Oh, wow. So what does that mean?
Do you know if Lakeview is going back?
I know that they're hybrid. So
They're doing hybrid.
I believe it's like 2 days a week or something.
I know what Lakeview's doing.
You do?
Yeah, so for the high school, if you want to do online, they let you just do it at the pace. Like the teachers will give you like a week's worth of work. And they'll give you a due date that you're supposed to have all the work done by. And like they just let you do your work at your own pace. But they are also letting you go back to school though too here soon, I'm pretty sure.
Well, I'm pretty sure they went hybrid because I have 2 nephews that go to Lakeview.
Yeah.
Today, my sister Chloe went to, Penfield, the elementary. They're going back to school today.
Okay. So Dustin, I don't know what to tell you on that one. I don't know. We can talk at the end of class if you'd like about it, but whoever answered mitosis is right. Back to the subject at hand. Okay, create the half set of chromosome. What's that called?
Father.
Not the word I'm looking for here. It's meiosis. I mean, technically you're not wrong, but we're looking for a specific vocab word. Okay. When the egg and sperm meet, what's that? We've talked about that multiple times. What would that be?
Zygote.
Well, what is it called when they meet each other?
Isn't that conception?
Yeah, conception. There you go. That one's coming up though. A stronger trait within, written with capital letters BB. What is that? Starts with a D.
Dominant.
Yes, some. And then a weaker trait with written with lower cases.
Recessive.
Yes, thank you. And then a fertilized egg. There we go. So whoever gave me that one with the Z.
Zygote.
There you go. Okay, and then identical twins are what? Remember this one? Monozygote. Mono meaning one. And then fraternal. Dies. Got. Whoops. Giving birth to more than one child at a time. What's that called? Dustin, your mic's on, bud. I missed that. Rachel, can you tell me that one more time?
Multiple births.
Thank you. And then joined together, combined, united. What is that called?
Conjoined.
Yes, very good. Thank you. Okay, when an X gene from the mother is faulty, there's a 50-50 chance of the child inheriting the disorder.
Is it the one that's the one with the kids conjoined?
No.
It's the sex links are X-linked.
Yep, there you go. Okay, a group of symptoms typical of a particular disease or condition is known as a
Syndrome.
yes, thank you. And then a condition that is present at birth.
Congenital malformation.
Yes, very good. And interaction of genes with other genes or with the environmental factors.
Chromosomal error.
Oh, multifactorial defect. That one's coming up. Too many or too few. That's where you have the error. There you go. All right. Thank you for all that participated. Okay, we're going to switch back to our note taking. And I'm going to do the note taking probably until maybe 10 minutes or so. And then we're going to talk about our little project that we're going to be working on. Okay. So let's go back to our notes. They should be, you should have a copy of those and be, you should have worked on them. Azaria, are you able to access yours?
Yeah, I am.
Okay. That's what I was hoping. Okay. So I'm just going to go ahead and I believe in Azaria, I know you have your notes out, so just correct me if I'm wrong, that we finished genetic counseling and we're on prenatal tests.
Yeah.
Okay, perfect. All right, so that's where we're going to start. So hopefully you have your, you have yours open and then we can get started. Okay, so I believe I'm a little bit off on this. There we go. All right. So there are things that people can do for prenatal testing if they're uncertain. So like more than 100 birth defects can be detected before the baby is even born. So they can do this AFP test, which is about the proteins. They can do an ultrasound that we've talked about before. They can do an amniocentesis, chronic villi sampling. And then in the next few slides, I'm going to kind of dissect each one of those. Okay, so to give you a little bit more information about each one. And then Azaria, if you don't mind, I'll just use you as my person that tells me kind of like my temperature as far as like, are you done with the slide? Do you need it longer? So if you could just, give me a dink or something.
Yeah.
To let me know that I can go on to the next one.
Okay.
Okay, thanks.
You're good.
Okay, thank you. And then remember too, if you do fall behind, there is always the recording, okay? All right, so some birth defects can be treated before birth. So advances in prenatal therapy now make it possible to treat some birth defects before birth. So they'll do like a prenatal surgery.
You're good.
Thank you. Okay, so this is what the AFP is all about. So it's a blood test performed at about 15 to 22 weeks gestation. The AFP is a protein produced in the liver of the fetus. Abnormal AFP levels can indicate a possible birth defect. High levels could be multi-gestation, placental abruption, neural tube defect, abdominal wall defect, or error in date of gestation. Low levels usually will indicate Down syndrome, trisomy 18, and diabetic patients. So that is one test that they would do if warranted to determine that.
I'm good. I mean, like,
I know I wrote some of them in, but I can't remember which ones I did.
I just have like the thing. I just wrote like 2 down.
Oh yeah, perfect. That's all. If there was only 2 bullets, you're good. Yep. Don't go too crazy there. All right. Moving on. Okay, so an amniocentesis, if you look at the picture there, it is a small sample of amniotic fluids surrounding the fetus is removed and examined to detect certain birth defects. Usually around 15 to 20 weeks gestation, a thin, hollow needle is inserted through the woman's belly and uterus, and some of the amniotic fluid is removed. Most often used to detect syndrome. So with all my kids, there was no indication that there was an issue. So an amniocentesis was not something that I had done. Okay. But it's possible that, you know, if I had a child with a birth defect, my second child, I might want to do an amniocentesis just to see. You know, so there's all sorts of reasons, but like I said, you know, had 3 kids, never, you know, didn't really have much issue during pregnancy. You know, there wasn't any genetics in my family, and so I was never given an amniocentesis. But it is one of the ways to detect certain birth defects. It kind of looks kind of scary to have this big needle going down in your abdomen, but it's for a good purpose. And then Azaria, just let me know.
Yep, I was just gonna unmute and say I was good.
Okay. All right, so here we go. Okay, and then a chronic villi sampling. So it's a test that takes a tiny tissue sample from membranes that encase the fetus. CVS is usually how they'll speak of it, requires taking a small piece of the chronic villi, which are the wisps of tissue that attach to the pregnancy sac to the wall of the uterus. The villi contain the same tissue makeup as the fetus. So first, the vagina and cervix are thoroughly cleansed with an antiseptic, and then using ultrasound as a guide, a physician inserts the thin tube through the woman's vagina and cervix to the villi and uses gentle suction to remove a small sampling. Tests for some disorders as amniocentesis does not detect neural tube defects, and usually performed between 10 and 12 weeks gestation.
I'm good.
Okay, thank you. Okay, I'm gonna do one more, maybe 2 more, and then we'll go into the project. Okay, so ultrasound, a technique that uses sound waves to show an image of the baby in the womb. They can monitor development, they can pinpoint baby's age, they can detect certain birth defects. Problems with the baby's skeletal, circulatory, or nervous system may be detected. It does help confirm the due date and the presence of more than one fetus, and it's routinely performed about week 20. They also can tell the sex of the baby at this time. A lot of parents opt for that in this day and age. I'm trying to think. I think I only knew one of my kids, and it was my son, because I had 2 girls before, and I just figured I was going to have another girl. So I was just like, just tell me, you know. And then I was shocked when they told me I was having a son. So it just depends. Sometimes too, when you go to ultrasound, the legs will be closed and the technician won't be able to tell you what the sex of the baby is. Ultrasounds by insurance usually only cover 1 ultrasound, if any. And if you want a specific ultrasound, like a 3D ultrasound, you might have to pay for that on your own. Not many, like in doctors that monitor pregnancies, they may not have that 3D ultrasound in their office. So Dustin, here, there you go. And so if you wanted the 3D ultrasound, they might have to schedule it somewhere else. Like when I was having kids, there was only a 3D ultrasound in Grand Rapids. So if I wanted the 3D ultrasound, I would have to go to Grand Rapids to then get the ultrasound. The 3D image is just going to show, you know, it's not going to be a like skeleton. A regular ultrasound, basically, you're going to see your baby, but you're going to just see all the bones. Where a 3D ultrasound kind of shapes the baby a little bit, and you kind of have an idea of what they might look like. I mean, it's kind of distorted, but you can, you know, see that. So, and then this will be our last slide after that once Exaria tells me it's okay to go.
Yeah, it's good. For mine, I had all that already written down, so I didn't have to write down it.
Yep, some of them I tried to give you a break on, so. Okay, this is the last the slide today, and then I'm going to talk to you about your project. So you have ultrasounds may be used for the following reasons. To rule out an ectopic pregnancy, that means that the baby's growing in the fallopian tube that's ectopic, so it helps rule that out. Confirms more than one baby. It does verify the due date, so you have more of an idea of when the baby's due because they take all these measurements, and by the size of the baby and the development of all the systems that are going on, they can, you know, kind of spit out a new due date that might be, you know, could have been dead on to the one the doctor gave you. It could be, you know, earlier or later. It's just all on what the tech use on the screen with the development of that baby. They, like I said, fetal growth. They can identify possible miscarriages, determine cause of bleeding, help perform other prenatal diagnostic tests, diagnose certain birth defects, check the fetus's well-being late in pregnancy, and help to select delivery methods. So, you know, it has a lot of good qualities that help the doctor kind of assess the situation a little bit more concretely so that everything throughout the pregnancy can be successful and that there's a wonderful package at the end that's healthy and vibrant and ready to take on the world. So, all right. So I'm just going to put my marker in. We'll have one more set before we're done. I remember the due date's not till Friday. And then Tanner, I know that if I don't get the notes done next time, you will help me remember to move the due date back if I need to. But we'll see for now. All right. So I'm going to get off of that. And I want to talk to you about your little project here. Okay. So I'm going to go into the Google Classroom. I'm going to open up the presentation and I'm going to talk about it. Okay. So your options for the project, what I need to know today before you leave is number one, what birth defect you want to do. And if you're working with somebody on it. Okay. I want all of these to be taken. So once somebody takes it, we're going to not pick it unless everybody else has picked one, and then we'll go back to it. Okay.
So I can't have the one I already picked that was a different one that wasn't on there.
I knew that you did that, and I already made allowances for that, so you're fine.
Okay.
Okay. All right. So, I'll just go over the ones that are up for grabs. So muscular dystrophy, Down syndrome, congenital dislocated hip, cystic fibrosis, cerebral palsy, Tay-Sachs disease, fetal alcohol syndrome, spina bifida, PKU, cleft lip, cleft palate, progeria, Fragile X syndrome, hemophilia, sickle cell anemia, Marfan syndrome, achondroplasia, and clubfoot. Okay. So, I'm just gonna call on people, and I just want you to tell me which one, and then I'm gonna put your name down. Okay. Okay, there's a hand that just went up. Whose hand was it? All right.
Since you already know I chose that one, you can put my name down for that one. Since you already know it's the one I
What were
chose.
you doing? Conjoined? What's your topic again? I can't remember. I think it was
Progeria.
Oh, okay. Okay. Thank you. All right. All right. So Kelsey Thomas, can you tell me which one you would like to do?
Is there a way for you to come back? Because I did not make a choice yet.
What do you mean come back where?
Like, come back to me, like, ask me again.
Oh, yeah.
Okay.
I got you. Okay. So, all right. So the list is up. All right. Xaria, you helped me out today, so I'm going to let you tell me what you want.
I want to do cystic fibrosis.
Okay. And then if I misspell names, let me know, because I'm trying to do this as quick as I can. All right. How about Jordan? Which one do you want to do?
Can I do Down syndrome?
Yes. Okay. How about Kyla?
Can I do, I don't know, I'm gonna butcher the name, but
Okay.
cerebral palsy.
Yes, you didn't butcher it. You got it right on. Okay. See if I can stretch that. Oh, goodness. That was a mistake. We'll go back. Okay. How about, is Cameron out there? Cameron? I thought I saw him, but I wasn't sure if he's stuck around. Okay, Gia, what's your choice? Rachel?
Can I do Fragile X
Yes.
syndrome?
Where's that?
Can I do the third one?
Who just talked to me?
Gia.
Gia, okay, cool. Which one did you want to do?
The third one?
Fetal alcohol syndrome?
Yeah.
Okay. Okay. For some reason, I can't do Rachel's in a color. It's not letting me. Okay, well, whatever. All right. How about Donovan? Donovan in the house. Okay, Monica, what's yours?
I did conjoined twins. I don't.
Okay, that's okay.
Okay.
Okay, so I got that. All right, what about Callie? What do you want to do?
I want to do
You know me.
muscle dystrophy.
Muscular dystrophy, got you. Okay. Okay, what about Tanner? What did you choose again? I can't remember.
What did I choose?
Yeah. Do you remember?
Down syndrome.
Down syndrome, you said?
Yeah.
Okay. Where is that? Oh, up here. Okay. And then, is Kaden Hempstead in class today? I wasn't sure. Logan? Is Logan still there? How about Sarah?
Can I do the cleft lip?
Yes. Okay, and then Brooke, I'm not sure about that one. How about Kaden Babcock? Are you in the house? Okay, so Logan, let me get off this. Let me see who's here. Okay. All right, so Cameron, I see you're here, but you're not responding. So are you here or not here? Donovan, are you here or not here? Because these are things that you need to weigh in on. Caitlin, do you have a preference? Here or not here? Okay, there's Donovan. All right, so Donovan, out of the choices for the parenting project, look at the screen. Which one do you want to do? You could do hemophilia, Marfan syndrome, clubfoot, achondroplasia. You could do sickle cell anemia, spina bifida, PKU, Tay-Sachs disease, congenital dislocation of the hip. What sounds good? All right, so Donovan, I need to know, you can put it in the chat and that's fine. I just need you to pick something. And then Kels, if you've decided on something, let me know.
Can I do spina bifida?
Is that Kelsey?
Yeah.
Yes. There it is. Okay. All right. Good. Okay. Donovan and Caitlin, I need an answer, please. Caitlin, clubfoot, got it. Okay. And Donovan, I need to know your answer, please. Okay, so Azaria, will you monitor that, the chat? If he responds to me, that'd be great.
Can you zoom a little bit,
Yeah, I
Miss
can do
Zepka? He said he can't see the choices. It was too small.
Oh, okay. Well, he can use the little magnifying glass right here to make it bigger, or maybe he can't. I can try.
Yeah, I don't think we can on this side because you're presenting.
Does that make it better?
Yes. There you go, Donovan.
And then I can scroll down too. So there's Marfan syndrome, achondroplasia, sickle cell anemia, PKU.
He said that it's glitching.
Okay, well, can you hear my voice? If you go to Google Classroom and just open the document, all of them are there. If that would be better, like to visually see, that option as well. Let's see. If anybody else is here that I did not give you a or you did not pick a topic, I need you to unmic and let me know. Because I need to move on. Okay, so Cameron, which one do you want, bud? Okay, so go into Google Classroom and open the project document, and then all of them are in there. You just have to scroll down and look at them. Okay, I read you loud and clear. So this one, I got to get out of this magnifying glass here. Okay, so this one will be, oh my goodness, stop it. Okay, this one is going to be Cameron. Okay, there we go. All right, anybody that I missed? I'm going to go out of this for 1 second. I'm just looking at the people that are here that I want to make sure I hit on them.
If the people aren't here, are you going to choose their topic?
Probably I will, yeah. Okay, so everybody has a topic that's here, and I just want to go over the expectation. Okay, so right now I'm going to use muscular dystrophy as the one I'm showing you. Hopefully you can see it. So what you want to give me in your Google Slides is the overview of muscular dystrophy. Like, how common is it? What are the different types? What are some common physical traits? What causes it? The risk factors, how it gets to be diagnosed, if there's treatment available, if you can prevent it, if the information is not able to be found, then you need to put something like, you know, couldn't find the information or doesn't have a form of treatment or something like that. All right, so Donovan, I am going to give you PKU, so that will be yours.
So I thought the questions from the other document were the questions.
Okay, so McKenna, can I just talk to you about that after class, and I will explain what happened with that. Okay, excellent. All right, and then, you know, is there an average life expectancy? What are some common medical problems? Include images, you know, pictures, things like that. And then you guys need to have it organized, have it kind of be flowing so that it's not glitchy. Use visual aids, title, the delivery. You guys need to make sure that you know, your tone and your volume and how you pronunciate things, you need to practice. You know, I don't like you guys to just copy and paste stuff onto a slide, because you need to understand it, what you're teaching. So if you copy something that makes no sense to you, it's not going to make any sense to us. So I would prefer no copying and pasting happening. Just get information, put it in your own words, put it on a Google slide, okay? Don't give me copy paste. All group members need to participate. Have an interactive portion, like you could do a Quizlet, you could do a note page, kind of like what I do at times with the guided notes. You could do that. And it needs to be about 5 at the minimum and up to 10 as the maximum, okay? So this is the criteria that we're going to be working with, and I thought we'd get a little further today. So the next time we meet, I'm going to dictate the entire class period to be working on your project, so that I can field questions, give you an opportunity to get something going. Is there anybody that wanted to work with a partner that, you know, had maybe talked to somebody about that? Okay, so Caitlin, you and Sierra, right? Anybody else that's gonna work with somebody in the class besides Caitlin? All right, so Caitlin, does Sierra know what you chose? Does she know that you guys are doing the club foot one? Okay, all right. All right, so with that being said, I'm gonna be here for questions that you have. McKenna, stick around because I wanted to talk to you briefly, really quick before you head out. But anybody else can stick around and unmic and ask me anything. But I would kind of get started on this, and the next time we meet, you'll have the full class time to work on it, and then ask me any questions that you might have. And then when we go back in person, that's when I'd like you to present it, unless you're going to be virtual, and then you'll present it to me on Wednesday. And so, questions. I will take any question you have. Okay, well, that's all I have for today. Oh,
Ms.
question.
Zepka?
Yes.
So when are these like due?
I would like them due on the 25th, so when we go back in person, we can present them. But, you know, things, you know, we
Okay.
may need more time. I don't know. It's going to have to be, I'm going to put it as the 25th for now, but then it might be adjusted depending on how and what you guys talk to me about next time we meet. Does that make sense?
Yeah.
Okay. And then Caden, we just picked, is he here? Okay. So we just picked projects. So I just need to know if you want to do sickle cell anemia, hemophilia, Marfan syndrome, Tay-Sachs disease, or congenital dislocated hip. So that's what I need to know from you. And if you don't tell me, I'm going to pick one for you. So any thoughts? Mr. Caden. Looks like Kat's got your tongue. Okay, let's have you do hemophilia. So Caden, we're gonna have you do that. Hemophilia is gonna be your job. Okay, all right, so I'm all set, guys. I will talk to you later, and we'll see you Wednesday.
Will we continue these notes?
Yes, Tanner,
problem-
yes, we
problem-
will.
Okay.
Yep, thank you for reminding me.
Okay.
Okay.
See ya.
Yeah, bye-bye. All right.
Mrs.
Dustin?
Zepka,
Yeah.
how can I get my transcripts over to Lakeview?
I believe you'd have to call Mrs. Avery and ask her to send them. Or send a release. Like sometimes I think they have a release form that you have to sign and then they'll release your information.
Okay.
Okay. Call the school if above all. I mean, they'll know what to tell you, so.
Okay. Thank you.
Yep, no problem. All right, McKenna. Does anybody else have any questions for me? Gia, Kelsey?
I do.
Okay, go ahead.
I was not in the room when you were talking about groups, and Kyla Lake texted me, and we want to be in a group together.
Okay, do you want to do cerebral palsy or do you want to do the one that you chose?
It does not matter to me.
Okay, so it's spina bifida or cerebral palsy. So email me later today and let me know.
Okay.
Okay, thank you.
Yep.
Okay. Gia, do you have a question? Cameron? Okay, so McKenna, will you unmic yourself so I can tell you why that is?
Yeah.
Okay, so because you guys get accommodations, your assignments will be a little bit different.
Okay. That
Okay,
makes
there's
sense.
not as many expectations for you as it is for the other kids. So
Okay, and I
that's
have
why
one more
that
thing
is.
to say about it.
You what?
Is it okay if I find like like a minute or two video of the a kid with progeria and show what they look like, kind of? Could that be my visual one thing?
Yes, as long as I can view it before you show it.
All right.
Okay.
Thank you.
You are welcome. All right, guys, I will check you later. It's 12:20.
See you 6th hour.
Okay, bye.
Bye.